All right. Which is not a typical place for a massage therapist to work? Is it a spa, an emergency room, immediate care, chiropractor's office, or a gym? And the answer is an emergency room or immediate care facility. When performing trigger point release on a client's hamstrings, the massage therapist begins experiencing shoulder pain. The therapist is performing the technique with 120 degrees of shoulder flexion, 120 degrees of shoulder flexion, and 50 degrees of elbow flexion. What could be changed to improve this technique? Shift weight forward, stack the wrists, elbows, and shoulders. Shift the weight backward, increase the amount of shoulder flexion. Straighten the elbow, increase the amount of shoulder flexion. Shift the weight forward and use the core to flex the back. That's a tricky question here. And the answer is shift the weight forward, stack the wrists, the elbows, and the shoulders. The therapist in this scenario is not using proper body technique. They should shift their weight in order to apply pressure rather than bending and extending the elbow. This bending movement will quickly cause fatigue. The joints of the therapist's upper and lower extremities should be stacked. In order to move into a proper position, the therapist should shift their weight forward to reduce the amount of shoulder flexion down to 90 degrees. Your shoulders should always be over your work. When a massage therapist washes his hands, what is the best way to turn off the water? With the fingers of the non-dominant hand, with the pinky finger, with the thumb, or with a paper towel? The answer is with a paper towel. Because of shorter attention spans, which client population would benefit from a massage duration of no more than 15 to 30 minutes? Pregnant women, geriatric, athletes, or pediatric? And I would say probably pediatric, yeah. Which of the following should be avoided when a massage therapist is considering dress and preparation for work? Which should be avoided? Wearing flat shoes, wearing polyester pants, wearing a button-up shirt, or the use of cologne or perfume? The use of cologne or perfume. And the reason is because many people are either sensitive or allergic to strong smells. Fill in the blank with the best option. When communicating feelings, a massage therapist should be as specific as possible, use you messages, as in you do this and you do that, right? Use reflective listening skills, which are like, if the client says to me, the therapist, the client says, the room is too cold, I'd like a cover. Reflective listening would be, okay, the room is too cold, you'd like a cover. Is that correct? Or adhere to HIPAA regulations. So when communicating feelings, a massage therapist should be as specific as possible. For example, consider replacing a word like upset, like are you upset, with alternative words such as concerned, discouraged, flustered, or something similar. This specifically improves communication and makes it easier to resolve conflict. You messages are not the most effective form of communication. Reflective skills are an important part of communication, but speaking about one's own feelings is not the same as listening. While a therapist should always adhere to HIPAA regulations, communicating one's personal feelings does not usually put a therapist at risk of violating HIPAA. Okay, so what this question is asking is, it's saying when communicating feelings, a massage therapist should. Because of the way the sentence is structured, the only person person who's mentioned is the massage therapist. So what this sentence is asking is when the massage therapist is communicating the massage therapist's feelings, a massage therapist should be as specific as possible. Yeah. Use you messages. No, that puts the emphasis on the other person rather than on the massage therapist. The massage therapist is the one who's communicating his or her feelings. Use reflective listening skills. Those are good, but those don't. The question is, how do you discuss your own feelings as the massage therapist? HIPAA guidelines. Well, HIPAA is good all the time, but that's not relevant to discussing your feelings. So this could be something like, this is a situation where The massage therapist needs to talk about feelings with the client. For example, something from our last session, something you did or something you said made me feel creeped out, right? Or afraid to be alone with you, right? We've all had that, people of all genders, right? Who work one-on-one with people. You work long enough, it happens, unfortunately. So instead of saying something you said made me feel creeped out, what this is saying is, what this is saying is try to soften the message so it's not directed as much towards the other person without placing so much responsibility on the other person. Soften it such as something from our last session bothers me or made me feel uncomfortable, right? So specific as possible. For example, consider replacing a word like upset with an alternative such as concerned, discouraged, or flustered, or something similar. And the reason it improves communication and makes things easier to resolve is because the harsher the word and the more accusatory the word, the more difficult it is for the other person, for the client to actually receive the message, to actually listen. Because if people feel defensive, it's difficult for them to listen. Now, professionally, I don't agree with this. I think you should be straight up with people. Last time you did this or you said this, and that's off limits here, outside my comfort zone. You have a choice to work with me or not, and I need you to work within my boundaries, right? You can either do that or you can get rid of the person. But for the MBLEx, for the purpose of the MBLEx, you want to soften things, right? You want to consider alternative terms. And they call that being as specific as possible. Notice I'm spending a lot of time on this, and that's because I feel that it's non-intuitive. Most of us would want to protect ourselves and be very honest with the person or refer the person out. And the second reason is because they're saying be as specific as possible when what they mean is use alternative phrases, and that's to soften the communication and not be accusatory. So anyway, this is one of those tricky questions that I hope they don't give you. Okay, a massage therapist has been filling in for another therapist who is on maternity leave using her massage table instead of his own. The therapist feels he is flexing his back and bending his waist more than usual with this new table. What should the therapist do to fix this? Begin standing on a small stool during a treatment, decrease the table height, bend more at the knees, increase the table height. And the answer for this is to increase the table height. Please mute yourselves. Which of the following types of massage therapist employment status does not require a tax form for filing year-end taxes? Is it the independent contractor, the sole proprietor, or the salaried employee? Does not require year-end tax form for filing year-end taxes. That is none of these. Regardless of the type of employee status, all massage professionals that earn a minimum income will need to file taxes. A professional's income must exceed a certain minimum in order to be taxable. The threshold is determined by the IRS. So just assume that the person in this question is exceeding the threshold or meeting the minimum. Whether you're an independent contractor, a sole proprietor, or a salaried employee, all of them must receive a tax form in order to file year-end taxes. What do clients seek through a massage from a massage therapist? Companionship, well-being, medication, or diagnosis? The answer is well-being. Massage therapists must obtain what before beginning a massage treatment? Advanced specialty training, informed consent, a passing jurisprudence exam score, or a professional certification before beginning a massage treatment? Informed consent. What is the initial expenses? Blank is or are the initial expenses of a business when it first begins operations? Budgeting, investment capital, expenses, or startup costs? Startup costs. When is it appropriate for a massage therapist to wash their hands? Before and after touching each client, only when the hands look soiled, at the beginning of the workday, or when the client has a cold? before and after touching each client. In building a trusting and respectful professional relationship with a client, communication is essential. Which type of communication skill is performed when the massage therapist relates the information to indicate the massage was received and understood? You messaging, active listening, giving advice, or reflective listening? The answer is reflective listening. Effective listening skills are essential for focused, client-centered care. When the massage therapist practices reflective listening, the professional restates the information that was given by the client to indicate a clear understanding of the massage. For example, I'm a new client and I say, I would like help with low back pain that I've had for several years. You as the massage therapist would say, okay, you want help with low back pain that you've had for several years. Have I got that correct? Let's see. Of the following options, which is a goal of HIPAA regulations? Reimbursement, privacy, credentialing, or billing? The answer is privacy. Which formula is used to calculate net income? Gross income plus expenses, gross income minus expenses, savings minus expenses, savings plus expenses, gross income minus expenses. Massage therapist must obtain the client's consent for all of the following except deciding which form of written or electronic documentation to use, releasing the client's medical records to another party for specific types of massages or draping alterations, acknowledgement of financial considerations. Deciding which form of written or electronic documentation to use. What type of solution should be used to disinfect surfaces in a massage room? Hot soapy water mixed with 10% chlorine bleach, 5% chlorine bleach mixed with alcohol, vinegar water. The answer is hot soapy water mixed with 10% chlorine bleach. Mixing bleach with alcohol is dangerous. Which of the following is not a requirement to become a massage therapist? Education, experience, certification, or clientele? And the answer is clientele. Of the following options, which is the most effective way to reduce the spread of infection from one person to another? Hand sanitizer, the use of gloves, the use of gowns, or hand washing? Hand washing. Which is the best reason for a massage therapist to use proper body mechanics when conducting a massage? Best reason, it provides more relaxing massage for the client. It prevents the therapist from injuring his own joints and muscles. It could cause the therapist to injure the client. It allows the therapist to perform his duties with accuracy. It prevents the therapist from injuring his own joints and muscles. A massage therapist has recently graduated from school where he learned about the basic principles of Western medicine. He is especially interested in working with clients who have spinal injuries and herniated discs. He secures employment in a chiropractor's office. A client comes to him and says he has experienced great results in the use of essential oils with other massage therapists and would like him to use aromatherapy techniques during today's massage. What is the best course of action for this therapist to take? So he learned about the basic principles of Western medicine, especially interested in working with clients who have spinal injuries and herniated discs, gets employment in a chiropractor's office, and a client comes in who has experience with essential oils being used in sessions with other massage therapists and asks him to use aromatherapy technique during today's massage. What's the best course of action for this therapist to take? Politely explain to the client that he is not trained in the use of essential oils and refuse to treat her using this technique. Do not treat the client with aromatherapy in the first session. In his own time, he should do some research into aromatherapy and begin using these techniques when he feels ready. Politely explain to the client that aromatherapy is not an appropriate treatment application. If she wants to utilize essential oils on her own, she should proceed with caution or use essential oils during the session. The answer is politely explain to the client that he is not trained in the use of essential oils and refuse to treat her using this technique. When a business arrangement is set up between two or more massage therapists as equal owners, it is known as an independent contract, a sole proprietorship, a partnership, or a corporation. That is a partnership. A massage therapist is 70 inches tall and is trying to adjust the height of a new table. What is the best height for the table to be set? 42 inches, 40 inches, 30 inches, or 35 inches? The answer is 35 inches. So I didn't know that, and I'll bet most of you did not know it either. So let's read the explanation. In general, table height should be half of the massage therapist's height. So half of 70 inches is 35. It's a good starting point. Okay. A massage clinic has been very busy for the past week, and the owner didn't have time to do the laundry. In her 15-minute break between clients, a massage therapist notices there currently are no more clean fitted sheets. However, other linens are still available. What should the therapist do? Turn the current sheets inside out for the next client, strip the sheets off the table, clean the table, use clean flat sheets, blankets, and pillowcases to cover the table and drape the next client. Use the same sheets again since they do not appear to be visibly soiled, or cancel the next client's appointment. The answer is to strip the sheets off the table, clean the table, use clean flat sheets, blankets, and pillowcases to cover the table, and drape the next client. A massage therapist in a hospital setting is working with a client who has a respiratory infection. It is known that with this infection, the droplets expelled with a cough or sneeze only travel 1 foot away from the client. Would the use of a mask help protect the therapist from the spread of this infection? No, the mask will have no effect. Yes, since the droplets only travel 1 foot away from the client. Yes, since droplets are not capable of causing an infection. Or no, since the massage therapist is not immunocompromised. The answer is yes, since the droplets only travel 1 foot away from the client. A mask should be used when working with clients who have diseases that can be transmitted via large particle droplets. Droplet transmission occurs when a person exhales, coughs, or sneezes. To protect oneself from this type of transmission, a mask should be used when performing a massage. A mask is effective for droplets that travel less than 3 feet. Examples of these types of infections are flu, measles, common cold, and strep throat. A massage therapist becomes a sole proprietor and opens a private practice. She writes a detailed business plan, which includes her monthly income and expenses. When calculating her projected income, which of the following is not an important component to consider? Which of the following is not an important component to consider? Is that the time spent performing massage, the time spent writing soap notes, the cost of doing laundry, or the number of clients she can reasonably see each week? Which one is not an important component to consider? That's the cost of doing laundry. Of the following options, what is the most effective way for a massage therapist to expand their client base? Paid social media ads, word of mouth, flyers, or by working with a chiropractor? And that is word of mouth. Word of mouth is the most effective way for a therapist to expand their practice. When opening your own massage therapy business, it is essential to have a clear business plan. Which of the following is not a necessary component of a business plan? A specific client list, operating procedures, advertising and marketing plan, or financial projections? And the answer is a specific client list. Although it's important to identify a target market, that means a market is a group of people, it is not essential to include a specific client list when writing a business plan. It is unlikely this information will even be available before the business implements a marketing strategy. Client list. So target market may be important, but a client list, you're not going to know who you're treating yet, the individuals who you're treating yet. Which of the following is not appropriate behavior for an employee? Accepting the authority of a supervisor, discussing personal conflicts with clients in order to build rapport, being loyal and patient, having a positive attitude, discussing personal conflicts with clients in order to build rapport. Just a minute, please. When draping a client, the massage therapist accidentally drops the sheet on the floor. What is the best next step? Put the sheet in the dirty laundry bin and use a new clean sheet. Shake the sheet to rid it of dirt or dust and use it to drape the client. Inform the client of what occurred and ask them if it is okay to use the sheet. Wipe down the sheet with antimicrobial wipes and use it to drape the client. Put the sheet in the dirty laundry bin and use a new clean sheet. Fill in the blank. Every massage therapist should be certified in vaccine administration, CPR and first aid, pregnancy massage, or nursing. The answer is CPR and first aid. A therapist is working with a client who just had surgery and has some clear discharge coming from the incision site. When treating this client, what precautions should be used? Universal precautions, standard precautions, contact precautions, or droplet precautions? Standard precautions. Standard precautions are used to prevent the transmission of disease through any bodily fluid. They should be used anytime there's contact with blood, any body fluid, non-intact skin, or a mucous membrane. In this case, the client has drainage coming from the incision, so the therapist must use standard precautions. These include hand washing, the use of gloves, and potentially gowns. Universal precautions were originally designed to be used only when contact with blood was possible. Contact precautions are used when a client knowingly has a contagious disease that is transmitted by touching the client, like MRSA, C. diff. What is C. diff? MRSA, C. diff, etc., or with an open wound. A closed surgical incision is not considered an open wound. Droplet precautions are used when the client has a contagious disease or infection that is transmitted by droplets in the air through coughing or sneezing, like pneumonia, whooping cough, coronavirus, flu, cold, strep throat. Which of the following best identifies why massage professionals commonly use soap charting? It is a secret and confidential form of charting. It is a professional and organized charting system in which the massage therapist can document pertinent client and treatment data. It ensures proper hygiene and sanitation during treatment. It is a business document that clearly demonstrates outgoing expenses and incoming revenue. It is a professional and organized charting system in which the massage therapist can document pertinent client and treatment data. These are SOAP notes we're talking about, and it's nice to, it'd be good to review the parts of the SOAP note. So SOAP, S stands for subjective. The subjective section is to record any information the client informs the massage therapist of, like I feel pain here, I'm experiencing this, experiencing that. That's the S in SOAP. The O in SOAP is objective, which is for the massage therapist to record any observed objective information, like the pain being present at 10 degrees of leg extension. So that's range of motion. What causes the pain? What alleviates the pain? Do you feel, you massage therapist feel tight muscles or flaccid muscles? Is there atrophy? Is there hypertonicity? Heat, cold? The assessment section, letter A, is to record the massage therapist's assessment of the patient's condition, as well as the patient's ongoing process, like the client has presented with splinting of the left gluteus medius and quadratus lumborum. After a 1-hour session, the client's range of motion increased to 15 degrees before the onset of pain. The plan section is to record the massage therapist strategy, such as, relieve pain and calm the nervous system, 4 treatments before reassessment. Fill in the blank. In order to protect themselves from the legal and financial implications of malpractice, a massage therapist should maintain medical insurance, record-keeping system, liability insurance, or a business plan. To protect themselves from the legal and financial implications of malpractice, maintain medical insurance, a record-keeping system, liability insurance, or a business plan. The answer they're looking for is liability insurance. Infections can be spread through all of the following except food, touching a sterile surface, through invasion of a weakened immune system, or airborne particles. The answer is touching a sterile surface that's free of pathogenic organisms, a sterile surface. What is the purpose of lubricant during massage? to moisturize the skin, to transport pharmaceutical agents such as anti-inflammatory agent, to reduce drag and friction over the skin, or all of the above. To reduce drag and friction over the skin. Which of the following is an example of reflective listening? The massage therapist listens to understand but does not respond. The massage therapist restates the client's report of discomfort in the quadriceps to ensure proper understanding. Please mute yourself. Thank you. The massage therapist gives advice on proper elevation techniques to reduce edema. The client reflects on his experience after receiving a massage. Which of the following is an example of reflective listening? And that is, massage therapist restates the client's report of discomfort in the quadriceps to ensure proper understanding, reflective listening. Fill in the blank. A massage room should be able to maintain a temperature of 70 degrees Fahrenheit, 72 degrees Fahrenheit, 75 degrees Fahrenheit, or 68 degrees Fahrenheit. And the answer is 75 degrees Fahrenheit. A massage room should be able to maintain a temperature of 75 degrees Fahrenheit. This ensures the comfort of the client and the therapist. The temperature of the room is especially important during massage, and clients are usually not fully clothed because it can easily become chilled. Which of the following best explains why it is important to document your work and keep files? Work documents are required for recertification. The NCTMB requires documents for all clientele. Liability insurance requires full documentation of clients. Work documents are needed for your portfolio. Liability insurance requires full documentation of clients. Which of the following options is a good way to save on advertising expenses? Pay for an ad on social media, mail out flyers, rent billboard space, set up a client referral program. Set up a client referral program. A client referral program is a very inexpensive form of advertising. Potential clients are more likely to come to you if one of their friends recommends you. Word of mouth advertising requires no startup capital. You may consider offering discount massages for clients who refer their friends, but since this expense comes after you book a new client, it is not an upfront investment. When are independent contractors required to pay taxes? Once a year on December 31st, once a year on April 15th, quarterly, or monthly? The answer is, there's a duplicate there. Yeah. Quarterly. When performing a technique that involves passive movement of the hip, what is the best way to drape to maintain client modesty, but still allow access to the upper thigh and the hip? Wrap the sheet around the proximal hip, exposing the rest of the leg. Pull the sheet up to the proximal hip and allow it to rest there. Leave the leg completely under the sheet. Wrap the sheet around the knee, leaving the shin and the foot exposed. So passive movement of the hip, right? Wrap the sheet around the proximal hip, proximal versus distal, exposing the rest of the leg. Pull the sheet up to the proximal hip and allow it to rest there. Leave the leg completely under the sheet, or wrap the sheet around the knee, leaving the shin and foot exposed. The correct answer is to wrap the sheet around the proximal hip, exposing the rest of the leg. The massage therapist is applying a technique to a client lying prone on the massage table. At what angle should the therapist's shoulders be in order to be in relation to the contact point on the client's body? Remember the last question, the person started at 120 degrees and they said, bring your shoulder down to 90 degrees. Should the angle be 90 degrees, 45 degrees, 0 degrees, or 180 degrees? And the answer is 90 degrees. Perpendicularity. Never seen it phrased that way in my life. So perpendicular, 90 degrees, is a basic concept that is very important for therapist body mechanics. By applying pressure at a perpendicular angle, 90 degrees, the therapist uses the minimum amount of effort to achieve the maximum effect. This prevents the therapist from exerting unnecessary energy and will make massage more sustainable in the long term. Pressure applied at a 45-degree angle causes an unnecessary increase in work for the therapist. The 0-degree or 180-degree application angle would not be effective at all, as the pressure would be applied parallel to the tissues. Which charting method includes a revision section for the documentation of alternative interventions? Which charting method includes a revision section for the documentation of alternative interventions? Well, there's only one way to chart, and that's SOAP. So is it SOAP, SOAPier, SOAPy, or POMER? Oh no, I was wrong. Well, this is why you take classes, so you can see your leader get it wrong and learn. That way you don't have to get it wrong. Taking one for the team. SOAPier. The problem-oriented medical record, POMR, focuses on specific client problems. It is most effective in acute long-term care and home care settings. SOAP, SOAPy, and SOAPier methods are examples of formulas that can be used in POMR charting. SOAP is subjective objective assessment and plan. SOAPy is subjective objective assessment plan, intervention, and evaluation. SOAPier is subjective objective assessment plan, intervention, evaluation, and revision. So it's SOAPier. Womp, womp, womp. A newly graduated massage therapist has an interest in palliative care and wants to specialize in oncology massage. Of the following options, which is the best course of action for this therapist to take? Get a job as an orderly at a hospice, seek out additional training in geriatric massage, seek out additional training in oncology massage, none of the above. Seek out additional training in oncology massage. So a newly graduated therapist has an interest in palliative care. Palliative is relieving symptoms in those whose conditions are probably terminal or can't be helped otherwise beyond being comfortable, and wants to specialize in oncology massage. Oncology refers to cancer. And the correct answer is to seek out additional training in oncology massage. Okay, I'm missing a question. Okay, sorry, it looks like I'm missing a question. Let me just mark this. Oh, sorry, guys. All right. Which of the following is not a method of transmission for HIV? An open sore coming into contact with the blood of someone with HIV, coming in contact with the saliva of a person with HIV, accidental needle stick with a needle previously used to inject an HIV patient, through the breast milk of someone with HIV, coming in contact with the saliva of a person with HIV. It is important for a massage therapist to know the routes of transmission for various diseases, especially HIV. HIV cannot be transmitted through saliva, skin, tears, sweat, air, water, or through sharing toilets or drinks. Therefore, when treating a client with HIV, it is not necessary to be concerned with coming into contact with the sweat or skin of the client. HIV can be transmitted through blood, semen, rectal and vaginal fluids, and breast milk. One of the most common ways for this to occur in the medical field in the US is through accidental needle sticks. While the client moves from a prone to supine position, what should the massage therapist do? Lift the edge of the top sheet farthest from the therapist and instruct the client to turn. Lift the edge of the top sheet closest to the therapist and instruct the client to turn. Press the therapist's leg against the side of the table pinning the top sheet in place, then lift the center of the top sheet and instruct the client to turn. Stand beside the table and instruct the client to turn, allowing the client to retain full control of the top sheet. And that is press the therapist's leg against the side of the table, pinning the top sheet in place, then lift the center of the top sheet and instruct the client to turn. That's surprising, but that's the answer they're looking for. Okay, so it's not lift the edge of the top sheet farthest from the therapist. It's not lift the edge of the top sheet closest to the therapist. It's not stand beside the table and instruct the client to turn, allowing the client to retain full control of the top sheet. It's press the leg against the side of the table, pinning the top sheet in place, then lift the center of the top sheet and instruct the client to turn. The purpose of valid evidence-based research in the field of massage therapy is to use patient satisfaction for increased revenue, to justify the artful form of massage, to objectively demonstrate physiologic responses to massage, or all of these? The answer is to objectively demonstrate physiologic responses to massage. A massage therapist is planning to open her own clinic. She's currently going through the process of making sure the building meets all standards. When designing a bathroom, which of the following are requirements? Family style bathroom, hot and cold running water, tight fitting doors, several stalls, soap in any type of dispenser, open top container for trash, hot and cold running water, soap in a covered dispenser. Hot and cold running water, soap in a covered dispenser. A massage therapist is reading a study that states a new massage technique was statistically significant in reducing pain levels when compared to a placebo. In this situation, what does statistical significance mean? The probability that the effects of the technique are the cause of the pain reduction is high. The probability that the effects of the technique are the cause of pain reduction is high. The probability of other undefinable factors being the cause of pain reduction is high. The reduction in pain was caused by the technique with 100% certainty. The results of the study were likely secondary to the placebo effect. And the answer is A, the probability that the effects of the technique are the cause of the pain reduction is high. Statistical significance simply implies that it is more likely than the tested technique caused pain reduction rather than any random chance or outside factor. Statistical insignificance means that outside factors and random chance are less likely to be the reason pain was reduced in this study. It is impossible in scientific studies to ever say that something was caused by something else with 100% certainty. There's always a level of uncertainty. The placebo effect occurs when no actual treatment is applied, but positive results are still obtained. Just a moment, please. When a client is in a side-lying position, where would you place a bolster or pillow to take pressure off of the pelvic joints and ensure comfort of the knees? Between the legs, under the head, under the arms, or under the knees? The answer is between the legs. You would place a bolster or pillow between the legs to take pressure off the pelvic joints and prevent the femoral condyles. So the condyle of the femur are the bony parts of the femur bone above the knee. So if you slide your hand down your vastus medialis, you'll come to these bones right before you get to the tibia. And these bony protrusions on the inside and outside are the femoral condyles. What we think of as the bony knees. Yeah. A therapist is hired to perform weekly massages for the employees of a large corporate office. The company pays the therapist as an independent contractor. In this situation, which of the following is definitely true? Legally, the therapist is self-employed. Legally, the therapist is an employee. The company is responsible for withholding taxes from the therapist's paychecks. The therapist is not required to report any tips received from clients. Legally, the therapist is self-employed. Legally, independent contractors are self-employed. All the following are required to be on every page of a client's health record, except the client's first name, the clinician's signature, the client's record number, or the client's last name? And the answer is the clinician's signature. Certain pieces of information must be present on every page of a medical record, while every entry in the medical record should be signed by a clinician. So an entry is done by date. It's like every date that the client comes in for a treatment, you make a new entry and you sign for that entry. So you could have 3 entries on one page, or you could have 2 pages for one entry. A signature is not required on every page of the record. This may occur if the note is written for a client is longer than 1 page. In this instance, the therapist only needs to sign at the end of the note rather than on each page. A client's full name and record number must be on every page of the record. This ensures easy identification of the client and minimizes the chance of miscommunication or mistaken identity. Massage for athletes often requires certain modifications. Which of the following is not true of this population? Athletes in training have reduced adaptive capacity. Receiving massage too often can cause tissue damage. Athletes in training have increased adaptive capacity and would benefit from daily massage. Like anyone else, athletes have a widely varied tolerance of massage techniques. Not every athlete prefers deep pressure, or it is common for athletes to sustain overuse injuries. So the question is, massage for athletes often requires certain modifications. Which of the following is not true of this population? And the answer is, athletes in training have increased adaptive capacity and would benefit from daily massage. Athletes in training have decreased adaptive capacity. As a result, the massage therapist must proceed with caution. If they are subject to overly aggressive techniques, or if they receive massage too often, the treatment can do more harm than good. As with any other demographic, every athlete has a unique relationship with massage. Not every athlete prefers deep pressure. It is extremely common for athletes to sustain overuse injuries, as they normally perform certain activities very repetitively. Okay, guys, give me just a moment to blow my nose. Okay, start video. All right, thank you. A massage therapist secures a contract to work for Relax Your Body, an independently owned mobile massage therapy service. She will be paid per client visit rather than an hourly wage. What type of employment is this? Partnership, sole proprietor, independent contractor, or employee? The answer is independent contractor. Which of the following is an example of mentoring? A recently graduated massage therapist works with an experienced therapist to improve their hands-on massage techniques. A recently graduated massage therapist attends continuing education courses to improve their massage techniques. An experienced massage therapist works with another experienced therapist to conduct a research study about long-term outcomes. A recently graduated massage therapist purchased a practice test in order to prepare for the MBLEx. Which one is an example of mentoring? A recently graduated massage therapist works with an experienced therapist to improve their hands-on massage techniques. Fill in the blank. Your client is in the supine position. You place a pillow or bolster under her bent knees. By doing this, you are taking pressure off of her ankles, patella, cervical spine, or lower back. The answer is the lower back. During an experiment, neither the subjects nor the researchers are aware of who is receiving the treatment versus the placebo. What kind of experiment is this? Randomized controlled experiment, single-blind experiment, double-blind experiment, or prospective? Neither the subjects, that's the clients or patients, nor the researchers are aware of who's receiving the treatment versus the placebo. That's called a double-blind study. A client presents with many serious and ongoing symptoms that appear related to gastrointestinal distress. Based on their understanding of pathology, the therapist believes this client may have Crohn's disease. What is the best course of action for the therapist to take? Refer the client to a physician, refer the client to an acupuncturist, diagnose the client with Crohn's disease, continue massage as usual since this is outside the therapist's scope of practice. Refer the client to a physician. What is the definition of a massage professional's scope of practice? The knowledge base and practice parameters of the profession, client authorization for any service received from the massage professional, right and good conduct that is based on moral and cultural standards, type of credential required by law to regulate the practice of a profession to protect the public health, safety, and welfare. The knowledge base and practice parameters of a profession. Let's go through some of this. So the scope of practice encompasses parameters. Parameters are like boundaries in which a professional may practice based on their education, experience, and certifications. For licensed massage therapists, the American Massage Therapy Association, AMTA, defines massage therapy as any skilled manipulation of soft tissue, connective tissue, or body energy fields with the intention of maintaining or improving health by affecting change in a relaxation, circulation, nerve responses, or patterns of energy flow. With additional training, massage therapists can become important team players within the scope of practice of other healthcare professionals to assist in care for clients. However, massage therapy should not be mistaken as a medical service. Client authorization for any service received from the massage professional, that's called informed consent. Right and good conduct that is based on moral and cultural standards, that's, I believe that's ethics. Type of credential required by law to regulate the practice of a profession to protect the public health, safety, and welfare, that's licensure or certification. Okay, blank is an aseptic technique that destroys all organisms by means of heat. That is sterilization, disinfection, isolation, or bleaching. The answer is sterilization. Disinfection destroys most pathogens on an inanimate object, typically by chemical means. Bleaching an item is one form of disinfection. Isolation is a technique that separates potentially infectious individuals or materials from uninfected individuals. Wearing personal protective apparel equipment is one example of an isolation technique. Which of the following media outlets does not impact the professionalism of the massage therapy field? Twitter, Facebook, personal blog, or none of these? Does not impact the professionalism. The answer is none of these. Ethical and professional behavior need to be considered with the use of all forms of social media. Successful massage therapists have developed emotional intelligence. What is emotional intelligence? The knowledge, skills, abilities, attitudes, and self-awareness to support productive and beneficial interpersonal relationships. Knowledge, skills, abilities, attitudes, and self-awareness to support high client productivity rates for maximum revenue. Knowledge, skills, abilities, attitudes, and self-awareness to support continued clinical education for self-advancement within a practice. The ability to ignore one's own needs and focus only on the client. The answer is the knowledge, skills, abilities, attitudes, and self-awareness to support productive and beneficial interpersonal relationships. Fill in the blanks. A massage therapist is standing at the corner of the massage table closest to the client's right shoulder while they apply pressure to the trapezius. In order to maintain proper body mechanics, the therapist's back should be blank and the joints of their shoulder and arm should be blank. So the therapist's back should be relaxed. The joints of their shoulder and arm should be stacked in a straight line, or the therapist's back should be straight and the joints of their shoulder and arm should be stacked in a straight line, or the therapist's back should be straight and the joints of their shoulder and arm should be flexed, or the therapist's back should be turned to the right and the joints of their shoulder and arm should be extended in a straight line. And the answer is straight back, shoulder, elbow, and wrist stacked in a straight line. Of the following options, what is the best description of a mission statement? information regarding the industry's trends, a list of services provided by a business, a written statement of a business's goals and purposes, a statement listing the business's expected expenses and revenue, a written statement of a business's goals and purpose. The massage therapist is finishing a conversation with a colleague when she hears a commotion from the waiting room. She runs into the room and is the first person to arrive. She sees that a client has fallen on the floor and is unconscious. He is not breathing and has no pulse. What should the therapist do first? Yell for someone to call 911, begin CPR, call 911, call 911, monitor the client, and wait for the paramedics to arrive. And the answer is yell for someone to call 911. So let's take a closer look at this situation and how they prioritize things. This is clearly a life-threatening situation. In these situations, someone must immediately call 911. Since the therapist is not in the clinic alone, she should yell for someone to call 911 first. While it is the responsibility of the massage therapist to perform CPR, it is not the very first step when there are other people present. If the therapist was the only one in the clinic, then she should call 911 herself. CPR should be started as soon as possible, but again, it is most important to have someone call 911 before CPR is started. Once someone is in the process of calling 911, CPR can begin. The therapist should not wait for paramedics to arrive. What type of insurance covers the expenses associated with injuries that occur on your property and result in litigation? Litigation means somebody suing you. What type of insurance covers expenses associated with injuries that occur on your property? Renter's insurance, liability insurance, medical insurance, or homeowner's insurance? That's liability insurance. Professional liability and premises liability. Which of the following statements about body mechanics is false? Perpendicularity is required to ensure the exerted pressure is directed straight into the tissues. Weight transfers should be performed by shifting the center of gravity away from the force applied. Stacking joints atop one another is essential for perpendicularity and weight transfer. The back should be kept straight by stabilizing core muscles. Which of the following about body mechanics is false? Weight transfer should be performed by shifting the center of gravity away from the force being applied. The four basic concepts of body mechanics are weight transfer, perpendicularity, stacking of the joints, keeping the back straight. Okay, it's 9 o'clock. Let's take a break. I'm just going to highlight that for myself because I want to make a teaching slide off of it later. Let's take a break, come back at 9:11, come back at 9:11, come back at 9:11 Eastern time. Okay, here we go. Continuing on. Which is the accurate term to describe the amount and source of money coming into and going out of the company? Is it cash flow, total assets and liabilities, money earned before taxes, or what the business owes both currently and long term? That's cash flow, the amount and sources of money coming into and going out of the company. There are three main career tracks for a massage therapist, which is not recognized as a main career track: sports performance fitness, wellness spa, healthcare medical, pediatrics infants. And pediatrics infants is not recognized as one of the main categories. If you placed a client in the supine position, where might you need to use a bolster or a pillow? Under the ankles, under the knees, under the abdomen, or between the legs? Supine position, under the knees. Which of the following is not a concept related to proper body mechanics? Weight transfer, horizontality, stacking of the joints, perpendicularity. Not related. Horizontality. Body mechanics involve the four concepts of body mechanics are weight transfer, stacking the joints, that's perpendicularity. Oh no, I'm sorry. Perpendicularity is the angle of the shoulder. Stacking of the joints is the lining up of the shoulder, elbow, wrist, and fingers. and then keeping the back straight. So weight transfer, stacking the joints, keeping the back straight, perpendicularity. The client has recently begun having a new pain in her mid-back, and the massage therapist would like the client to see his physician for further diagnosis. After obtaining the client's consent, the massage therapist calls the primary care physician to alert her to the situation. After the phone call, what should the massage therapist do next? Document the call in the client's medical records. Tell the client she has spoken with his doctor. Tell the client to go to his primary care physician immediately. Tell the client to also call his primary care physician. Document the call in the client's medical records. It is essential for the therapist to document any phone communications immediately. This guards against the therapist misremembering or forgetting any details of the conversation. Fill in the blank. A client may be more comfortable when the therapist positions them using bolsters, pillows, or rolled up towels. The therapist should pay close attention to the placement of these items. When a client is lying in the prone position, they should never position a bolster under the client's forehead, under the client's ankles, under the client's knees, or under the client's abdomen. The answer is under the client's knees. You would not place a bolster or a towel under the, well, you guys, I think you get that. A massage therapist is the manager of the massage practice. Annually, she must ensure that the practice is following all HIPAA guidelines. What is the primary purpose of HIPAA regulations? To guarantee health coverage under a group plan, to regulate and encourage the use of paper-based documentation, to protect patient privacy, to describe appropriate massage techniques, to protect patient privacy. As a massage therapist, when are you permitted to release a client's medical records? When a client calls a massage therapist and requests his medical information be released, when the client's doctor calls and requests that the client's information be released, when a client signs a release of information form, when the client's insurance company requests the client's information. Sorry. That is when the client signs a release of information form. If linens come in contact with any type of body fluid, what should be done with them? They should be washed in a washing machine at any temperature. They should be thrown away in a black plastic trash bag. They should be washed separately with a detergent and an antiviral cleaning agent, such as bleach. They should be placed in a red hazardous material bag and disposed of properly. They should be washed separately with a detergent and an antiviral cleaning agent, such as bleach. Which population would require an adaptation to include specific informed consent and supervision? Would that be pediatrics, pregnant women, hospice patients, or athletes? That would be pediatrics. A massage therapist is disinfecting his massage table after a client came in contact with it. Of the following options, what is the best way to do this? Putting the table through a pressurized steam bath, wiping down the table with antibacterial soap, wiping down the table with a water vinegar solution, or placing a new sheet on top of the table. Wiping down the table with antibacterial soap. In order to disinfect a surface, chemicals must be used to destroy most pathogens. These chemicals could be alcohol, iodine, chlorine, or antibacterial, antimicrobial soap. Spraying and wiping down the table with an antibacterial soap is perfectly appropriate. This should be done before and after each session. A vinegar water solution is not antibacterial and therefore is not adequate. A massage therapist is the manager of a massage clinic. She has been tasked with buying new tables for the clinic. Which of the following would be the best choice? Adjustable height, 27 inches wide. Fixed height at 34 inches, 24 inches wide. Fixed height at 36 inches, 30 inches wide. Adjustable height, 22 inches wide. Adjustable height, 27 inches wide. If at all possible, massage tables should have adjustable heights. This is especially true at a clinic where more than one therapist may use the same table, and each person will need to adjust the height to suit their needs. Even if a table will only ever be used by one therapist, an adjustable table allows the therapist to raise and lower it as needed to accommodate clients of different sizes. A width of 24 to 48 inches gives the client enough room to be comfortable, but is not so wide that the therapist has trouble reaching the client. A massage therapist is working with a client on a floor mat instead of using a massage table. How does this change the therapist's body mechanics? Balance point and weight bearing occur at the feet. Balance point and weight bearing occur at the hips. Balance point and weight bearing occur at the knees, More pressure needs to be applied with the shoulders. So floor mat instead of using a table. So the person is on their hands and knees. Balance point and weight bearing occur at the feet. Balance point and weight bearing occur at the hips. Balance point and weight bearing occur at the knees. Balance point and weight bearing occur at the knees. So when doing a massage with a client on a mat on the floor, all principles of mechanics remain the same. The only difference is that the therapist is no longer weight bearing and balancing at the feet. Floor massage shifts this balance to the knees. Nothing else should change. While some balance may occur at the hips, most weight bearing does not occur here, but at the knees. The balance of pressure should not change to the shoulders just because one is doing a massage on a floor mat. 78-year-old client who fell 1 month ago is currently receiving a massage. The client lost her balance and fell on her back, which has been sore ever since. She has been cleared by her physician of all serious pathology. The focus during sessions has been relaxation, so the massage therapist has lit traditional candles to provide a calming environment. At the beginning of the session, before the client has a chance to sit down, the therapist leaves the room briefly to answer a coworker's question, then returns to the room and begins the massage. What is unsafe about this scenario? Treating after a fall, leaving the room lighting candles, working with a 78-year-old client, lighting candles, treating after a fall. Leaving the room, lighting candles. Client should be considered a fall risk since she recently had a fall. As a result, this client should not be left alone in a room, especially while standing. Additionally, open flames should never be present in a massage room due to the risk of fire. So the candles are a fire risk, which is independent of the client having had a fall, but also leaving the room is directly relevant to her having had a fall. Someone has a fall, you stay in the room with them, and you never leave candles in the room alone. And you never use open flames, which includes incense. Okay. Fill in the blank. A client's unique response to a therapist's professional touch is specific to a client's age, will be consistent with their goals in massage, will reduce cortisol and stress levels, cannot be assumed or expected. Cannot be assumed or expected. What is a common cause of burnout among massage therapists? Spending more energy caring for others than for themselves, working more than 10 hours per week, not following an employer's regulations, not having a clear code of ethics, which is a common cause of burnout. Spending more energy caring for others than for themselves. Fill in the blank. Researchers use what to gather and analyze objective data about a particular idea in order to test its validity? A hypothesis, the scientific method, internet research, or research literacy? The scientific method. To gather and analyze objective data about a particular idea in order to test its validity. Okay, looks like I have. Looks like I have a question missing. Yeah, sorry. A massage therapist has been diagnosed with strep throat. He fills his prescription for antibiotics, and after taking them for 30 hours, he feels a little better. Is it acceptable for him to come into work, and why or why not? Yes, the therapist has been on antibiotics for 30 hours. No, the therapist should stay home until he is symptom-free for a week. No, the therapist cannot practice with any contagious disease. Or yes, the therapist is feeling well enough to treat clients. No, the therapist cannot practice with any contagious disease. Okay. And it says the therapist should not come to work until he has no symptoms and is confident he is no longer contagious. It is excessive to require the therapist to stay home until symptoms have been gone for a week. Simply waiting until the symptoms are gone is sufficient. A massage therapist writes a business plan and presents it to potential investors. Of the following options, which information should not be included? The owner has 2 children. The owner has worked as a massage therapist for 15 years. The owner enjoys helping people in pain. The owner has experience doing administrative work. The owner has 2 children. Of the following options, which should be documented in a client's medical record? A statement that the risks and benefits of treatment were discussed after treatment, a statement that the client's social life was discussed, the names of the client's children, a statement that the client was informed of benefits and risks before treatment, a statement that the client was informed of benefits and risks before treatment. So here's another one. Missing a question. So, when I uploaded these, apparently I missed some of the questions here. Might be a good idea to have a look at these before I put them in front of people. I don't know. What do you think? Good idea? During a massage, the therapist should strive to use proper body mechanics. Which of the following actions is not an effective way to do this? The wrists and hands should remain relaxed. The therapist should look down at the client's body. The feet should provide a wide base of support and the body should be in good alignment. Therapist should keep the client's body close to them so that the length of the stroke is no more than 24 inches. The therapist should look down at the client's body. Not an effective way to do this, right? Not an effective way to get proper body mechanics. Which of the following is not a purpose of creating a client-practitioner agreement? Is that to better understand the client's desires, to clarify the nature of your services, to protect yourself from unrealistic expectations, or to act as reinforcement for client consent? The answer is to better understand the client's desires. A client-practitioner agreement is not created to better understand the client's desires. Massage therapists should use initial assessment and encounter notes to gain a better understanding of the client's needs and goals. For example, in the initial assessment, that's where you ask and the client answers the question, why are you here? What is your chief complaint? How can I help you? What are your goals in regards to your body or your health? Client practitioner agreements are created to clarify the nature of a business services. This business does this. This is the service we provide. This is what we strive to achieve. This is what you can expect from us. And to protect the business from unrealistic expectations and to act as a reinforcement for client consent. Like, this is what you're going to be getting here. This is what we shoot for. A massage therapist has been using lotion with most of her clients. She has recently run out of lotion in her room and needs to refill her container from her business's bulk supply. What is the best way to do this? Squeeze or pour the lotion into the container. Shake the lotion into the container using her hand to get the proper amount. Squeeze the lotion into the container using her hand to ensure fitting more lotion in the container. Scoop the lotion into the container using her hands. The answer is squeeze or pour the lotion into the container. When transferring lotion or massage oil from one container to another, it should never come in contact with the therapist's hands. This would contaminate the lotion. A massage therapist is working with a client with acute low back pain. The client has found side lying to be the most comfortable. During the massage session, where should bolsters or pillows be placed when in this position to emphasize client comfort? Under the neck, under the buttocks, under the bottom knee, under the head, under the bottom hip, between the calves, under the head, under the top arm, between the knees and under the top foot, under the neck, under the top arm, and under the bottom foot, under the head, under the top arm, between the knees and under the top foot. When removing used gloves, which of the following actions should be avoided? Using an ungloved hand to remove the other glove, touching the inside of the gloves, touching the outside of the gloves, turning the glove inside out, touching the outside of the gloves. Which body mechanic is not proper for a massage therapist to use while giving a massage? Knees slightly bent, wrists relaxed, back straight, elbows away from the body. Elbows away from the body. Fill in the blank. To reduce likelihood of allergic reaction, all lubricants should be what? Antibacterial, oil-based, in powder form, or scent-free. Scent-free. Fill in the blank. When applying pressure to reach deeper layers of tissue, the massage therapist alters the technique they use. The deeper the pressure, the more fatigued the therapist will become, the more narrow the base of contact required, the more broad the base of contact required, the more painful the massage will be for the client. The more broad the base of contact required. Pressure must be delivered through each successive layer of tissue to reach deeper tissue layers without damaging any structure. The deeper the pressure, the broader the base of contact required with the surface of the client's body. If the pressure is directed with a narrow base of contact, the client will likely tighten and guard against compression injury. It takes more pressure to address thick, dense tissue than to address delicate or thin tissue. Which of the following is not true of record keeping? A therapist is free to use any shorthand that makes the most sense to them, since their notes will always be private. Records should be written in ink or produced as an electronic format. A therapist should use only widely accepted abbreviations in case the records need to be reviewed by someone else, or each page of the record should identify the patient by name and by clinic or record number. A therapist is free to use any shorthand that makes the most sense to them, since their notes will always be private. A therapist is not free to use any shorthand that makes the most sense to them. So the question is, which of the following is not true of record keeping? And the nature of this question, excuse me a second. The nature of this question forms the basis for more than one phrasing of this question. So you may get two questions like this. If you do practice tests, practice exams, you may see it multiple times or definitely across different sites. And the concept is that you should use only widely accepted abbreviations in case records need to be reviewed by someone else. So only widely accepted. You're not, unfortunately, free to use whatever shorthand makes the most sense to you. Okay, we have completed 100, give or take, questions for the guidelines for professional practice. That's great. Awesome. So now let's move on. So we've done ethics boundaries. Let's see, who's here from the regular Tuesday, Thursday class? Stephanie, correct? Stephanie and Mint. You guys are in Tuesday, Thursday, right?
Yes.
Have we done ethics? Did we do ethics boundaries, laws, and regs?
From what I remember, I'm not sure. I missed 2 classes, so I don't know if maybe you touched base on.
Mint, do you remember?
No.
Ethics laws. Okay. So, well, okay. So I see on the 16th we did ethics. I don't know how much of that we got into. So, okay. All right. So, all right. We did that in Tuesday, Thursday. Okay. So then let's do, I have a selection of 10 questions. Where is it? From one of the other sections. Hold on a second. So I'll get that up in just a second. Techniques, pathology. Maybe we'll do techniques. EMP1, EMP2. No. Just a second. Therapeutic massage applications. Okay, I think we did therapeutic massage applications at one point. Tuesday, Thursday, do you guys remember if we did therapeutic? Okay. Let's take a look at some of these. Massage techniques. Okay, I'll bet even if we did these, I bet you guys need some brush up on this for sure. Okay, no place like the beginning to start. Okay, fill in the blank. Blank can be light, moderate, deep, or variable. Trigger points, drag, compressive force, or holding. The answer is compressive force. Massage therapist is developing a treatment plan for a client of the following, which is the best example of a quantifiable goal or outcome. To increase shoulder flexion, range of motion by 20 degrees to allow for reaching overhead, need a reassessment of range of motion in 10 visits, return to independence with washing hair, or return to normal activity in daily living. That would be increasing shoulder flexion, range of motion by 20 degrees to allow for reaching overhead. Quantifiable, so something that can be measured. Of the following options, which is the best definition of a trigger point? A buildup of lactic acid, a pathology that produces referred pain, a discrete area of pain and or tenderness in a band of dense muscle tissue, an adhesion between two different muscles. That is a discrete area of pain and or tenderness in a band of dense muscle tissue. When performing hot stone massage, it is important for the therapist to place the stones directly on the client's skin, cool the stones to a temperature of 90 degrees Fahrenheit prior to each massage, sanitize the stones prior to each massage, not use gliding strokes as this may cause too much inflammation. And the answer is sanitize the stones prior to each massage. Okay, let me skip down to some of the more like nitty-gritty specific. Which of the following is not a massage benefit for one skeletal system? Not a massage benefit for the skeletal system. Stimulates the sensation of touch, improves the range of motion of joints, improves the joint's flexibility, improves the spine's curvature. Stimulates the sensation of touch, because that's not the skeletal system. Okay, let's see. This was an interesting one. How can massage therapy help the impairment sustained after a person has been seriously burned? By activating the muscles under the burn, by strengthening connective tissue, by improving connective tissue mobility, or by weakening connective tissue? And the answer was by improving connective tissue mobility. It doesn't actually weaken connective tissue, and it doesn't actually strengthen connective tissue. And activating the muscles can be helpful, but not in the case of recovering from a burn. When trying to promote venous return, the massage therapist should apply strokes to the extremities, moving away from the heart, toward the heart in a circular motion, or laterally. And the answer is toward the heart. A massage therapist is employed at a sports performance center. She is working with an athlete who wants to increase circulation to her muscles to prepare for a volleyball game, which will begin in 1 hour. Which of the following techniques are most appropriate for this massage? Broad-based compression, shaking and tapotement, focused trigger point work, aggressive tapotement, lymphatic drainage, muscle energy techniques. Broad-based compression, shaking and tapotement. Vibration and rocking are examples of oscillation. What, if anything, is the difference between these two massage techniques? Vibration is just another word for rocking. Rocking is a smaller, faster oscillation than vibration. Vibration is a full body technique. Rocking is only performed on individual limbs. Vibration is a smaller, faster oscillation than rocking. Vibration is a smaller, faster oscillation than rocking. Which of the following techniques has the greatest, which of the following techniques has the greatest effect on fascia? Petrissage, tapotement, effleurage, or friction? Friction. Tapotement is used to stimulate nerve response and to loosen phlegm. Effleurage applies light to moderate pressure to superficial structures, including skin, fascia, and muscles. Although petrissage or kneading does have an effect on the fascia and tendons, it primarily targets the belly of the muscle. Is that it for that one? Okay, yeah, that's it. Okay, so those were some interesting ones for massage techniques. Let's look at this. Let's look at this exam, the FSMTB MBLEx sample. So this is a. Actually, I should start. Yeah. Okay, so these are a bunch of questions from the non-hard science modules, from like, the ones we were just reading and maybe a couple of the others. So here's a HIPAA question, for example. HIPAA stands for Health Insurance Portability and Accountability Act, Health Information Portability and Accountability Act, Health Information Portability and Assurance Act, Health Insurance Portability and Accounting Act. And the answer is Health Insurance Portability and Accountability Act. A chiropractor writes a prescription for a patient to receive a 30-minute massage session once a week. The session should be focused on the cervical area. During a scheduled session, the client asks the practitioner to work on the lower legs and feet because she went for a jog earlier. What's the best course of action for the practitioner to take? Call the chiropractor and ask for verbal permission to modify the treatment plan, modify the original treatment plan to incorporate the legs and feet, and inform the chiropractor of the changes made to the session. Continue with the original treatment plan and inform the chiropractor that the client that the legs and feet may be addressed in the next session after consulting with the chiropractor, or have the client sign a new treatment plan and send a copy to the chiropractor. And the answer is C, to continue with the original treatment plan and inform the client that the legs and feet may be addressed in the next session after consulting with the chiropractor. So I could do that for you, but I have to talk to the chiropractor first. Good. Business plan questions. Which of the following components of a business plan comes first but should be written last? Which comes first but should be written last? Company highlights, executive summary, business objectives, or market analysis? And the answer is executive summary. So for the components of the business plan for questions like this, I really think you're better off just memorizing the answers rather than doing any kind of like research and trying to understand all the components of it. If you want to try to understand all the components, if you feel like you can read those things, read those explanations and understand them and remember them, great. But I wouldn't try to do that. I would just remember the executive summary comes first, but is written last. If a practitioner's table is too high, the practitioner is more likely to feel discomfort in which of the following areas? The neck and shoulders, the wrist and hands, the back and legs, the knees and ankles. The answer is the neck and shoulders. Guidelines for behavior that allows an individual to behave with honor is called competence, principles, advice, or empathy. The answer they're looking for of those four is principles. Which of the following processes results in a sanitized massage table? Utilizing a product that is effective against bacteria, utilizing a product that kills germs, the physical removal of dirt, the application of sterilization techniques? And the answer is using a product that kills germs. A practitioner is working with a client for the first time. When the practitioner begins to undrape the client gluteals, the client interrupts the practitioner and states that the area is off limits. Which of the following did the practitioner fail to obtain? Informed consent, disclosure, confidentiality, or scope of practice? And the answer is informed consent. I think we all Tuesday, Thursday, I think we practiced for this one. So this is a like anatomy and physiology question about the shoulder. Which of the following structures is found between the greater and lesser tubercles of the humerus? The greater and lesser tubercles of the humerus. So on the humerus in the front, there's the greater tubercle on the side with 3 of the muscles attaching. It's the infraspinatus, the teres, and the supraspinatus. No, supraspinatus, then infraspinatus, then teres attached there. And then on the front, it's the subscapularis on the lesser trochanter. So lesser bump or lesser trochanter in the front, greater trochanter on the side. What's between them? It's a groove. It's like a little valley. And the answer is it's the bicipital groove. So the short head of the biceps sits in that groove on the humerus. Spindle cells are located in the, spindle cells, look. Spindle cells are located in the what? Bone marrow, the skin, the belly of a muscle, or the brain? And the answer is spindle cells are located in the muscle. I don't know why I was like, all excited to see that question. I guess that's just how nerds react. Oh, we didn't look at this. This is good. We didn't cover this. The pad of muscles associated with the thumb side of the palm, pad of muscles is what? Palmar, hypothenar, thenar, or interosseous? And it's palmar. A practitioner is preparing to file her taxes for the first year as a sole proprietor. Which of the following forms would she need to file with the IRS? The answer is a Schedule C. Schedule C. That's the profits and expenses for business. Okay. Which of the following is an inherent part of informed consent? Advice, disclosure, competence, or education? And the answer is disclosure. You disclose the risks and benefits to someone, and then after the disclosure, then they have the opportunity to consent. You're giving them an opportunity to have informed consent. You inform someone through disclosure and give them the opportunity to consent. Yeah, trying to get as many like non-science, non-massage questions as possible. Which of the following statements best describes accounts payable? A record of monies owed by a practitioner to individuals or organizations. A system that helps to ensure a product is not out of stock. A summary of income and expenses for a particular pay period. A ledger detailing transactions from the petty cash account. And the answer is A, a record of monies owed by the practitioner to individuals or organizations. Aha, a regular client often calls his practitioner by his late wife's name and shares stories of his marriage with the practitioner. So if your name is Stephanie and your client is John and his deceased wife's name is Doris, and Stephanie, he's calling you Doris. That's what's happening here. At times, the client mentions that the practitioner reminds him of his wife. These are the questions you're going to get. This is the FSMTB making these questions. Which of the following terms best describes the situation? Is it countertransference, sexual harassment, transference, or power differential? The answer is transference. Okay, so transference is when a client personalizes their relationship or their points of view towards the practitioner. And countertransference is when the practitioner personalizes their relationship towards the client. How do you remember countertransference and transference? Well, the way I remember it is, in the healing profession, the client is supposed to be at the center. Things are supposed to be viewed and considered and positioned from the client, from a client-centric perspective. So transference, so the client comes first. Transference is a shorter word than countertransference. So that's how I remember it. Transference is a shorter word, and the person who comes the first, who is considered first, is the client. And the person who's considered second is countertransfer, is the client, is the practitioner. So that's countertransference in second. So the client is doing transference when they personalize their relationship with you. If you personalize or seek a personal relationship with your client, that's countertransference, because it's going from practitioner to client. I hope that's clear. What type of insurance program protects a business from alleged negligence by a practitioner? Is it general liability or malpractice? The answer is malpractice. A practitioner who is an independent contractor makes her own schedule and receives a W-2 from her employer, purchases her own supplies, is exempt from paying taxes, or must offer mobile massage sessions. So only one of these is true, and that is that she purchases her own supplies. I was hoping we'd find a transference, countertransference question. Which of the following is an ethics violation? Keeping a client files locked in a fireproof safe, having sexual relations with a current client, a practitioner flirting with a former client, sharing fees and policies prior to the session. The answer is having sexual relations with a current client. A practitioner has recently passed the massage and bodywork licensing exam, MBLEx. He immediately begins advertising himself as a licensed practitioner. What step may have been overlooked by the practitioner? Completion of a background check, application for a business license, securing personal and professional liability insurance, obtaining a massage license with his state jurisdiction. Obtaining a massage license. So you complete your schooling, then you pass the MBLEx, then you can use your MBLEx result to obtain a license from your state or jurisdiction. A client tells a practitioner that she would like a light pressure massage. During the session, the practitioner begins to perform medium to deep strokes over a myofascial restriction in the back. The practitioner explains that the area needs to be worked out. This is an example of what type of violation: ethics, confidentiality, boundary, or scope of practice. The answer is boundary. What marketing tool provides free media exposure for a business? Is that print advertising, publicity, radio advertising, or networking? Free media exposure, that's publicity. Print costs, radio costs. Networking is not media exposure. Maintaining clear and updated documentation pertaining to a client's treatment supports professional communication between colleagues, is not necessary if the practitioner is an employee, does not ensure the safety of the client, allows the client to return for another treatment. Maintaining clear and updated documentation pertaining to a client's treatment. So that's like soap notes, for example. Supports professional communication between colleagues, because your soap notes are written in such a way that anyone can look at them and understand them. Subjective, clients complaining of this. Objective, my findings through palpation was that. Assessment, cause of the symptoms is this. The plan is, whatever, X number of treatments using various types of techniques. Reevaluate at treatment number, whatever. So in theory, any practitioner that you work alongside with could pick up that client's file and be able to pick up where you left off, having understood the subjective, objective assessment and plan. Which of the following best describes informed consent? A form on which a client provides health information, the practitioner a form on which a client provides health information for the practitioner performing the massage session. Apologize, guys, I have a little formatting problem. Yes, okay, here we go. A form on which a client provides health information to the practitioner performing the massage session. Most popular method of recording client and session information in many healthcare professions, an intake process that ensures in writing that the client agrees to the nature and extent of the treatment, a requirement of a notary public signature on a health history form. The answer is an intake process that ensures in writing that the client agrees to the nature and extent of the treatment. Okay, anybody, what term is synonymous with prime mover? Fixator, agonist, synergist, or antagonist? Which term? Fixator, antagonist, synergist, or agonist? Which one?
Antagonist?
Ooh, we always need practice with this. I'm glad I asked you guys. Prime mover, the prime mover. What's the prime mover sound like to you? Does it sound like the muscle that's doing most of the movement or not most of the movement?
Most.
Yeah, most of the movement, the majority of the strength, right? That's the agonist. The antagonist goes against most of the movement, most of the strength goes against it. Yes, please mute yourself. Don't worry, we will be practicing those again. Are you in the Monday, Wednesday group? I know I just said please mute yourself. Are you in Monday, Wednesday? I can't see who answered.
No, that was me. That was Stephanie.
Oh, that's Tuesday, Thursday. Okay.
Yeah.
Well, all right, we'll work on that Thursday. And you should come to Monday, Wednesday, because we're working on that.
Yeah, I was planning to come for Wednesday.
Okay, good. Wednesdays and Mondays. Okay. What type of lubricant would a practitioner use for clients with sensitive skin? Petroleum-based, alcohol-based, non-hypoallergenic, or hypoallergenic? The answer is hypoallergenic. Let's see. Tension, compression, shearing, and bending are example of reflexive effects, mechanical applications, reciprocal inhibition, or isometric stretching. Mechanical applications. Why would a practitioner change linens after a treatment session? To comply with HIPAA standards, for aesthetic purposes, to avoid contracting an autoimmune disease, or for client safety? The answer is for client safety. Okay, one more. A practitioner notices increasing tension in the client's muscles as the session is progressing. The practitioner is performing what type of observation? Is that objective, psychological, ethical, personal, subjective? That is objective. The practitioner provides objective information. The client provides subjective information. Okay, guys. So that was like, it's a lot for your brain to like sit and listen to somebody talk and like to really stay attentive through that. So congratulations for hanging in there. We're going to do something similar on Thursday, except we're going to focus on a different section. And we might hit one of those other like anatomy and physiology systems, like maybe the digestive system or integumentary system or something like that. All right, guys, have a great night. Please text me with any problems, any suggestions, anything you want me to know. Give me your email address via text message. If you're not receiving the authorization to get into the Google Drive or any problems like that, okay? Have a great night, and I'll see you all hopefully tomorrow, hopefully Thursday, hopefully on the other side.
Thank you.
Thank you.
Okay. Good
You're welcome.
night.
You're welcome.